Bismillahirrahmanirrahim. Welcome all the viewers and exam aspirants. This video is about different tips and tricks on how to pass your FCPS TOACS exam in the first attempt. These are the last moment hacks you should know. I have discussed and shared with many of my colleagues, and many have succeeded to pass the exam in the first attempt, and so will you. This video is for all those who are aspiring to give the exam or for the gynae residents as well who are working in the ward. So if you are preparing for your exam or if you are working in a gynae ward, either you should study module wise. For instance, there are different modules which have already been discussed in the previous videos. These are labor module, maternal medicine, urogyne, infertility, and so on. Or you should study station-wise for your exam preparation. There are different stations which have already been discussed, which include short cases, counseling station, teaching station, drill station, Eurogyne station, or research station. So it's up to you how you do, and which is easier for you to study smart, either module-wise or station-wise. Practice from the different practice books available, the different type of stations, mainly the structure discussion and simulated patients station, so that you should know how you will approach different cases in your exam. What I did was to interpret the different histopathological as well as radiographs and different pathology slides reports, and so should you. In the exam, there is least likely that diagnosis or the impression will be given, but rather the cross-examination on the microscopic description of any of the histopathological reports will be given, and you have to diagnose that case and then discuss the management. So, directly no diagnosis or impression of any of the report will be given in your exam. So, what you need to do is to focus on the different microscopic as well as the gross details of all the histopathological reports, how you can practice it. It's very easy. Either you can take it from your hospitals, from different labs, from different diagnostic centers, or from the patients, and do study and focus upon the gross as well as the microscopic details of every histopathological report, and then come to the diagnosis. For instance, in this report, the microscopic description of the uterus and placenta has been given, which shows that the with chronic villi and decidual tissue has been infiltrated into the inner one-third of mammalian, and hence the diagnosis was placenta previa increta was made. So this is how you should know about the microscopic details, and then you can easily diagnose any of your histopathology reports in the year exam. So practice it. This is another example of the histopathological report. Let's go through the important topics. For instance, fibroid, any leiomyosarcoma, any other malignancy, ovarian cyst, in the arteriocyst, in the an ectopic pregnancy, in the OPS cases, the placenta increta, accreta, or previous spectrums, and their microscopic as well as gross examination. And hence you will master different reports and how to diagnose them. Moreover, interpret the radiographs. You will be given the radiographic impressions and the pictures, and you will not be provided with any of the diagnosis or the impression or report. So please focus on them. Just practice different pathological and the radiograph reports given from different patients, taken from different patients or in your ward settings, or just Google it, and take the important topics of gynae as well as OPS. For instance, ovarian hyperstimulation syndrome, ectopic pregnancy, miscarriages, the fetal biometry, and any other endometrial hyperplasia, and just focus upon the radiographic finding, and you will master each and every station in your exam. In addition to that, do the pathological slide of just important pictures and important topics only. You should know how the important topics, for instance, the fibroid leiomyosarcoma pathological slide is present. But this is just important topic. You should know, just focus on the important one. Then comes the one of the station in your exam, which is must and related to either research, appraisals, or protocol writings or clinical journals. These all have been discussed in different videos in my YouTube channel. Do subscribe it for more updates. Moreover, please, you should familiarize yourself with the different investigations and their prices, the types of investigations, and the availability of investigations in different laboratories of your current country, and moreover the prices of the investigations, because in an exam if you order any of the investigation you should know that its type, its availability, and most importantly the financial and the economical constraints related to that investigation. Otherwise you will not be able to pass your exam station. Power of counseling has its own place. Just start focusing on this and practice in your daily routine. Either you are working in your wards, counsel your patients, their attendance related to any particular problem, or for the exam, start counseling after any of your station, practicing any of your short case, for instance. Start counseling for the 10 minutes related to your particular problem or any disease with your patient, with your attendance as well. And this is how you can easily communicate with the patient and you can get the maximum score if you practice the counseling stations in your daily routine. Use the communication tool of SABAR, which includes situation, background, assessment, and recommendation tool to communicate easily with your colleagues. And this is how you can master any of your exam station in which communication with the colleagues has its separate rubric assessment. Lastly, do focus and you should know about the different complication risks, their percentages of different procedures, different surgeries, the beneficial and the side effects of each of the procedures. As in the constant station, you should know about the different percentages of the different complications or the risk factors or the any side effects of that particular problem. So these are the hacks you should focus on in the last moment of your exam. Just you should know that practice makes a man perfect. Do practice in your daily routine, whether if you are working as a resident or for the exam. Just do the daily practice of 10 minutes of each station and you can easily master that station and easily approach in your exam as well. Just believe in yourself. For more updates, do subscribe the channel and every link of every station and the PDF documents are available on the Telegram group by name of Dr. Aisha Gynae Guide. Thank you and good luck.